Okay, so my topic is about depression, just an insight on it and different depressions is disorders, what causes it, triggers. So what is depression? Depression is a medical illness that negatively affects how you feel. It makes you feel and think negatively. So having bad thoughts about certain things, you can, instead of having those positive thoughts you once had, they turn into negative. It causes feelings of sadness and loss of motivation of something you once enjoyed. So like you could be playing sports and all of a sudden you're not enjoying it anymore because you're having all those negative thoughts. It can also cause poor concentration and feelings of worthlessness, even thoughts of harming yourself. Because once you start having those worthlessness feelings, you can start having some thoughts about harming yourself. So some major causes of depression, it can be a various amount of things, but most of the main things are family history, health issues, medication and substances or substance abuse, money worries, death or loss of a loved one, and body dysmorphia disorder. And I put body dysmorphia disorder because when you're depressed, looking in the mirror can be hard because your point of view of yourself has changed. You doubt yourself and you don't like the way you look. And that goes hand in hand with body dysmorphia. So body dysmorphia is a disorder that affects your mind by creating false images of your appearance. This disorder can cause depression from viewing your body so much and wishing you were someone else. People who struggle with intense BDD can have suicidal thoughts and possibly get to the point of being hospitalized. Body dysmorphia really overwhelms your mind, and once it gets to the point of overwhelming, it can get to the point of having suicidal thoughts because you're not tolerating it and you just want the pain to end. You don't want to look at yourself and it becomes difficult. In an article posted by PubMed.gov, it talks about how it can be difficult to diagnose someone with BDD while having depression. The article states it can be difficult and challenging to diagnose BDD in depressed patients because the symptoms are often concealed due to embarrassment and shame. People who have depression and BDD struggle with shame and embarrassment because it takes a lot of courage to admit having these issues with themselves. Body dysmorphia can be mild for some patients, but the ones that have intense body dysmorphia struggle with the severe depression side of suicidal thoughts. They would rather attempt suicide than look at their own image every day. This also relates back to depression because it can make you feel lost and not want to look at yourself. Ultimately, body dysmorphia can cause signs of depression due to self-hatred, which most deal with when having depression. Body dysmorphia is something I used to struggle with in high school, and it did cause me to be very depressed or increase my depression and suicidal thoughts because it gets very hard to look at yourself. You'll look in the mirror and you see yourself, but you also see different images of yourself. So some people struggle with thinking they look too skinny, but that's not their actual image. And then some people think they look too fat. Like it's almost like you're seeing a different person in the mirror. So it goes with depression. It can be very overwhelming. So next I want to talk about is depression and suicidal tendencies. So most people know depression can lead to self-harming, suicidal thoughts because it gets built up and you get overwhelmed. And some people most people don't want to die. It's just they want the pain to end. So depression is known to cause suicidal thoughts when you've been struggling for years or even just 2 weeks. Depression affects you negatively, but when it builds up from not seeking help, it can cause thoughts of self-harm, which is why it's very important to seek help. But that's also the hard thing because most people are embarrassed of it and they don't want to get help. They'd rather just go about their day and go through the motions of it. Suicidal thoughts are formed from poor physical and mental well-being. Some thoughts include, I don't want to continue, I'm worthless, and I don't want to wake up. A lot of people who deal with suicidal thoughts oversleep because they do not want to deal with life and the responsibilities that may come during the day, which also relates to depression. Some people don't sleep at all, some people sleep, oversleep, goes both ways. There was an article that was posted by WebMD explains this better by stating, people who commit suicide don't want to die, but to end their pain. I think this is very important to understand about people who struggle with suicidal thoughts because they are in so much mental pain that they want it to just go away. It's not just that they want to die. It's more of, like I said earlier and just now, it's about ending the pain, because people who are suicidal, they don't want to kill themselves. They don't want to go through that type of pain. But the pain they're already going through is already feeling like they're dying. It's also never too late to seek help for yourself or someone you might know dealing with suicidal thoughts. It's also important to not ignore the signs of threats. Especially in my generation, a lot of people cope with humor. For example, someone can make a joke saying, "Yeah, that makes me want to end it." Even though their tone is not serious, it still can be a threat or concern, something to not ignore. I think it's a big warning sign when someone starts to ignore friends, family, or school, or just not showing interest in something they once enjoyed. I think those are like the main warning signs in someone, especially if they're, someone comes to school and they're always happy, and then one day they're not talkative to anyone or enjoying things. And you when you see that pattern continue, it's important to ask them if they need help or seeking someone to help them, because you could be saving someone's life who's struggling. So more about the warning signs of suicidal and depression. Talking so one of the things is like talking about wanting to die, guilt or shame, feeling like you're being a burden. I think that is another big struggle with the people who deal with depression. They always feel like they're being a burden and feeling like they can't talk to anyone because they feel like it's too much for them. But people who are truly there for you will listen to you. And I think it's a hard step to take, though, to open up to someone about this. Also, feeling empty, hopeless, trapped, or feeling like you have no reason to live. Extremely sad, anxious, full of rage, agitated, and unbearable emotion or physical pain. And there also can be changes in behavior, which is also a big warning sign. So once like they start making a plan or researching ways to try to attempt suicide, that's when you know it's time to step in and help this person. And when they start saying goodbye to friends, family, taking dangerous risk, for example, one driving recklessly, like saying like your friend's driving and or you're driving and they're like, oh, I can just go like that with the wheel and drive off, but like they're not joking. Additionally, extreme mood swings, eating, sleeping more or less than usual, and substance abuse can be a big warning sign. Most people do turn to substances. I know for myself, I've been through that, and it does make your serotonin levels decrease, your dopamine decrease, which makes your depression worse. But the substances is a short-term help for, it's not really help, it's just like a short-term feeling of happiness you have when you're on that substance, but in the long run it's not good for you. Suicidal thoughts can be overwhelming or complicated, but knowing the warning signs of someone who may be struggling is important to not ignore. There's always someone to help save your life or someone in need, or help someone in need. A lot of people who have friends that have talked about suicide want to tell their parents or someone that could help them, but their friend will insist on telling them not to tell anyone. Even though they are your friend, you might feel guilty about telling someone. It will end up saving their life in the long run. Never feel guilty because their life is at risk, and it's important to seek them help or for yourself. And I think this is very important because I've had friends or even myself where I'm like, don't tell my parents, or they're like, don't tell my parents, but you're getting to that point where you might make a plan. And that's when your friend is going to have to step in. And even though they will be mad at you for telling your parent or a friend or someone at school for guidance, it's going to help them in the long run because you're saving their life. So another depressive disorder, which it's kind of common, it's bipolar disorder. So it's also known as manic depression, which is again another type of depression. Bipolar is a mental health condition that causes extreme mood swings that involve emotional highs and lows. They struggle going from mania and hypomania. Mania is an emotional state of being energetic or sometimes aggressive and delusional. Hypomania is depressive episodes. These people will have these type of mood swings in a short duration of time. So someone who struggles with bipolar will say for 10 minutes, they're like hyper energized. And then the next 5-10 minutes, they're sad, suicidal. And then 10 minutes after that, they're angry. It's a cycle and it just continues. And usually you want to get it diagnosed with bipolar when you notice a pattern with your moods in a short duration of time, when it's been going on for weeks, because that's when it gets concerning. So there's also 3 types of bipolar disorder: bipolar 1, 2, and I'm not sure how to say this word. It's like cyclothymic disorder. They all involve like those mood swings I was talking about, but the specific disorders depend on how intense and frequent your mood swings are. So like your psychiatrist or primary physician can see like which type of bipolar you have to prescribe you the right medicine, because you might not need as intense medicine as like bipolar 2. Having mood swings are very different from bipolar mood episodes, which some people can get that confused, because like mood episodes, that could just be for 30 minutes, but like bipolar is like weeks and weeks and like every day. So an article posted by NIMH explains this better by saying, mood episodes are very different from the moods and behaviors that are typical for the person. During an episode, the symptoms last every day for most of the day. Episodes may also last longer periods, such as several days or weeks. I think it's very important to understand the difference, because you don't want to be misdiagnosed or try to diagnose yourself. Seeking a psychiatrist if you're feeling like you might have this disorder is very important, because you want to get treated for it. This article also mentions you can have mixed feature episodes. So this is where you can have the depressive symptoms, but also feel energized at the same time. So basically you're like manic and depressed, but at the same time. And that can get confusing for someone like, mixed emotions, but that's how it is for certain people. But bipolar is a pretty serious disorder, and it has to be treated if it's like that. So I actually had to do some research on this because I wasn't too sure about it. So it's called psychotic depression. I keep stumbling over my words because I'm nervous. So psychotic depression is the type of depression that occurs when severe depression turns into a psychosis, or also known as hallucinations. For example, someone may hear voices or feel like they're delusional. These voices can haunt a person, or the voices can tell them to hurt themselves. So like someone could have some voices about like, you should end it, and like but it's not really like, you're not really saying that in your mind, which is like a delusional thing, like a hallucination. So people who deal with this disorder are out of touch with reality. This can often be confused with schizophrenia, but the difference is the depression part. Psychotic depression deals with voices and hallucinations related to depression. They also try to hide it because they feel embarrassed about their disorder, which goes for pretty much all the disorders. This makes this type of depression hard to diagnose. Symptoms of this disorder include agitation, anxiety, constipation, hypochondria, insomnia, intellectual impairment, physical immobility, and delusions or hallucinations. This disorder is usually treated in hospitals because they need certain medications for the person to be calm and stabilized. This disorder needs to be monitored by mental health professionals to get the right treatment and diagnosis. The people who deal with this type of depression will have a lot of emotional outbursts, and it's hard to calm them down because they're hearing all these voices that they can't control, which is why they're out of touch with reality. They feel like they've lost themselves, and it's hard for them to calm down and like not have these thoughts. But if it's like mild, therapy is very beneficial for any disorder, but especially this one because that's a place where you can be vulnerable and not feel embarrassed about your type of disorder, especially psychotic depression. So another familiar disorder is seasonal affective disorder, also known as SAD. So this disorder affects your mental state when the seasons change. For example, someone could be really happy when it's summer weather, but once it changes to winter, that person starts to experience depressive symptoms. Symptoms of this disorder include fatigue, depression, hopelessness, and social withdrawal. However, there are treatments for this by using light therapy, also known as phototherapy, and medications. Light therapy helps when it's winter and you miss the sunlight. Vitamin D can also treat this disorder because it can give a serotonin boost, which will give you that happiness feeling for a little bit, even though it might be short term, but you can still keep doing the light therapy and the vitamin D. Vitamins are really also beneficial for depression, getting your hormones in check and all that. So in an article published by the Cleveland Clinic explains more on how light therapy works and is beneficial. This article states, to use light therapy or phototherapy, you get a special lamp. It has white fluorescent light tubes covered with a plastic screen to block ultraviolet rays. The light is about 20 times brighter than the regular indoor light. The intensity of light emitted should be 10,000 lux. This is beneficial because people can get those rays of sunlight they miss during times when it's not warm out. It gives a sense of hope and happiness to keep going through hard times of the winter. This can also be the opposite, but it's pretty rare. So there's a few amount of people that do struggle during summer because they prefer the winter. So it's, yeah, literally the opposite. So some people may use ice baths or create fake snow that can give happiness effect as well. Like honestly, anything that's cold. There's always an option to treat this disorder and use different ways to cope to like sub things in and out. So, but this disorder is very common and a lot of people deal with it. So this is the last depression disorder I'm going to be talking about. It's situational depression. I haven't heard too much about this. I've heard about it before, but so it's a type of disorder that it's also described as a mood adjustment disorder while depressed. For example, a person might have an overreaction to a situation, and they might overreact with more emotions than needed within 3 months of the situation that occurred. It is a short-term depression that is related more to stress, and it can develop after a traumatic life event. The symptoms are depression, but stress related. Some symptoms are loneliness, hopelessness, lack of motivation, frequent crying, and low moods. Some causes of this disorder are death of a loved one, job loss, divorce, relationship problems, retirement, natural disasters, and social issues. So like those symptoms are more of stress related, like natural disasters can give you a lot of stress, and people with this disorder will overreact. They'll like, something that's not true, but they think is true. They'll start buying a bunch of things, stocking up, just the overreaction part of it. So an article posted by Very Well Mind describes the diagnosis of this disorder more by stating, in order to be diagnosed with adjustment disorder with depressed mood, these symptoms must also cause marked distress and significant impairment in important areas of life functioning. So when you start to feel like stress is taking over daily life activities that deal with this disorder, like the depression too, and you feel like you can't get through your day to function, it's probably time to seek help for a diagnosis. But this is a well-known disorder that occurs after a traumatic life event that someone has gone through, like within the past 3 months. There is treatment for it by therapy or group support. There's also a type of therapy that helps create adaptive thinking instead of negative thinking. So overall, main treatments for depression, obviously therapy or group support, like I just said, therapy, one-on-one, or group support, you sit in a circle with some other people you might relate to that can make you feel like you're not alone, that you're not the only one going through this. Behavioral therapy, I feel like that would be more towards like bipolar and psychotic depression. I feel like that can help you change your mindset from a negative point to a positive point in help cope with things in your actions instead of overreacting and stuff. Obviously medications like antidepressants, just medicine for any disorder you might have, but obviously you want to get the medicine from a psychiatrist or primary physician. So I put rehab because a lot of people who deal with these disorders go through substance abuse, and rehab is also like group support and therapy, but your main focus is about the substances and like why you're turning to them and how can we help you get out of that. Basically better ways to cope again. Meditation, maybe that's just me, but I feel like meditation is very calming for people. It can help calm your thoughts, just like listening to music, just breathing. Obviously that also would help for anxiety. And the most important thing is to seek a psychiatrist, because if you are feeling like you have any of these symptoms, you want to seek a psychiatrist because they will get your exact diagnosis if you are being honest and with yourself and that person. I think it's very beneficial, but it's hard. It's hard for people to come out and say you have a problem. It takes time, but again, you just got to know the warning signs. So yeah. So this is the end of my presentation about depression, and these are my references, my 5 sources I used. So yes, thank you.